based on recent conferences hosted by the Healthy Schools Network and supported by the W.K. Kellogg Foundation, the National Institute of Environmental Health Sciences, and the California Endowments, the Education Facilities Clearinghouse, and others. Claire Barnett is going to be our presenter today. She is the founder and executive director of the Healthy Schools Network, a national 501c3 not-for-profit environmental health research and education and advocacy organization founded in 1995, and the coordinator of the National Coalition for Healthier Schools, co-convened by the network's board and its partners to provide the platform and the forum for environmental health at schools. Among her other appointments, Barnett is a member of the National Coordinating Committee on School Health and Safety and a national advisor to the Collaborative for High-Performance Schools. Under her leadership, the network has challenged the nation to ensure that schools are environmentally responsible to all children, to personnel, and to communities. Among the landmark policy reforms, the New York State Board of Regents guiding principles and comprehensive action for school environmental quality, 1995, laws to improve indoor environmental quality in schools in New York City and state, fostering reform coalitions in dozens of states, award-winning guides to empower parents and others to take constructive action to reduce risks, fostering the green cleaning healthy products in schools movement, and federally securing over $6 billion for school repairs, new authorizations for the U.S. EPA and education. The network also coordinates National Healthy Schools Day annually in partnership with the CDC, EPA, and APHA. In 2016, the network issued its fourth triennial State of the States Data and Policy Report toward healthy schools, reducing risks to children. Barnett received her BA from Mount Holyoke College and her MBA from Rensselaer Polytechnic Institute. And I'm going to turn it over now to Claire, and she's going to present today's topic to you all.
Great. Thank you so much, Travis. I really appreciate the opportunity, and many thanks to the Education Facilities Clearinghouse for hosting the webinar for us. Is this now under my control? Not yet.
I will correct that right now, and you should be able to move the slides.
Now I'm the presenter. Very good. Thank you. So here's the cover of our report, and I really want to call out and thank some of the partners who helped us put this together by sharing information and contributing to the press. And that includes the School-Based Health Alliance, the American Public Health Association Beyond Pesticides, the Massachusetts Coalition for Occupational Safety and Health, National Education Association's Healthy Schools Caucus, 21st Century Schools Fund, Environmental Law Institute Beyond Pesticides, Center for Cities and Schools at Berkeley, Improving Kids' Environment, New York Lawyers for the Public Interest, and many, many more organizations. It takes a lot of work to put something like this together, and this is not something anybody can do alone, but there have been a lot of conversations over the last year and a half to get it to where it is. So I'm going to give you just a quick overview. This is slide 3 of what we're going to talk about today. We're going to talk about schools as children's environments, what some of the common risks are, some of the steps that have already been put in place to prevent risks, then some of the data that we found in the new report that was released in August, then a short list, just one slide of selected resources, and then an invitation to celebrate with everybody else 15th Annual National Healthy Schools Day in 2017. So close your eyes for just a second or so and imagine what environment is. When you hear the word environment and you're asked to think ahead about it, what does it really look like to you? Most people can identify a wilderness as environment. Clean water, fishing, outdoor activities, and so forth. But environments are all the places where we spend our time. Children spend a great deal of time indoors. In fact, Americans generally spend 90% of their time indoors, And the Institute of Medicine has found and published recently that that's really where most exposures take place, is that chemical soup of the indoor environments where so many things we hope go right sometimes go wrong. So let's turn to some basic framing here. Organizationally, we and our many partners think about children in schools in some very specific ways. It's important to understand that biologically, children are not just little adults. They breathe more air per pound of body weight. They can't identify hazards. They can't get themselves out of harm's way. They very often cannot articulate exposures or tell people what happened. We also understand that schools are not just little offices. Schools are very densely occupied with very vulnerable occupants. Not only are most occupants children, but about 75% of the adults are women of childbearing age, also another vulnerable population. Schools are very densely occupied. According to EPA, they're about 4 times more densely occupied than offices. If you are sitting in an office right now, listening to this and watching it on your computer screen, take a look at the room around you, estimate the square footage, and how many little children would be in there with you if this were a reading class. The other thing we want to point out is there are actually more schools than zip codes, and it's helpful to sort of try to get people to think about the very, very large scale of public and private education in the U.S. For purposes of this presentation, I'm talking primarily about public schools, but we recognize that across the country there are 130,000 public-private schools in big numbers, occupied today by about 55, 56 million children. That's 99% of all school-age children are in a school today. And so there are more schools than zip codes. It's a very large decentralized enterprise. So let's talk about what some of these risks are to children's health that have been identified by many people, and particularly by a lot of work that EPA has done over the years. Hazardous school siting. EPA does have a guideline. It took about 2.5 years to get out the door on the siting on the ground of schools. So contaminated or compromised land and or proximity to noise and other hazards really presents a challenge. It is literally the most expensive wrong decision a school can make, is to build a new building on a contaminated site. There will have problems forever, and very expensive problems forever. Other very common environmental health problems include difficulties with indoor air, mold and moisture, pests and pesticides, and this will start to sound very familiar to a lot of people. Radon, of course, PCBs, that's polychlorinated biphenyls. Those are in light ballasts and caulk, primarily. Of course, asthma and allergy triggers, lead, asbestos, mercury, chemical fumes, and or chemical mismanagement. Bus idling by air intakes, poor facility management, that's really maintenance and repair jobs. Drinking water quality issues, excessive noise, and poor lighting. To that, I'd add poor sanitation. All these things affect the quality of the indoor and outdoor environment. Currently, the average age of a school building in the U.S. is about 50 years. Deferred and neglected maintenance can cause their own problems because they cause legacy toxics such as lead in paint, PCBs in caulk and light ballasts, and asbestos to be released when the walls break down and the roof leaks. The other issue is renovation and reconstruction of schools while they are fully occupied can also create new and unexpected indoor and outdoor threats to health and safety. There are about a dozen states which have policies in place regarding renovation in schools. We'll focus just a little bit on some of these things that schools can actually control. I want to point out that if you're the owner-operator of a school, you're a school district board member, superintendent, or leader, or a private school trustee or school head, you actually control this environment. And here's some of the things that you can control. You can control asbestos. You can control chemical management. That's a wonderful slide from EPA's chemical cleanout campaign. You can also address in many, many ways what happens to damp buildings. And the slide on the top right, where there's a floor fan trying to dry out a wall, shows you what happens to paint when it peels on a damp plaster wall, and it's undoubtedly lead paint. Here's another example in the next slide of poor maintenance. This is a student revolt. They want clean bathrooms, which sounds pretty reasonable, and healthy learning environments, which of course we all want for them. On the top right is, that's a CO2, carbon dioxide meter, which shows over 4,000 parts per million of carbon dioxide in an occupied classroom. What's interesting about that is the Harvard School of Public Health published, I think in 2011 or 2012, that adult critical thinking skills start a precipitous decline at 1,000 parts per million CO2. Now, everybody here who's been in a small closed room with several other people, everybody knows what happens. You start to nod off, and you start yawning. There's not enough. You stop thinking. You get tired. That's CO2 levels. And the way that gets addressed is you open the door or open the windows and let some fresh air in. So in closed buildings, classroom CO2 levels can get quite high. And that is a problem when you think that children breathe more air per pound of body weight and they're being tested and measured when they're falling asleep at their desks. The picture below was shared with us by the Texas State School Boards Association. We call this a hoarder classroom. If you watch HGTV, you know what hoarders are. And this is really an interesting problem. So this is a classroom which was extremely expensive to set up by the classroom teacher. It's now a classroom that is impossible to clean, impossible to control. You wouldn't know where to look for roaches or ants. And it's very inexpensive to clean up. So I would encourage anybody who is district personnel on the call, if you see classrooms like this in the buildings you are in, get them cleaned up or call public health. The problem of superstorms, which all of us see increasing on all the weather maps that we see every night on TV, climate is a real problem for schools. This is not something they can control, but it is something that will affect them. This is obviously a school surrounded by floodwaters, but other things have happened to schools as well, and we have many pictures of that. Some of the things that happen during climate, which will also affect schools, include high heat, which means that test scores are going to drop when classrooms get too hot. More water and more flooding, more moisture in the air will mean more pressure to do mold control and prevention. More heat in the outdoor air means more pests and more opportunity to engage in pesticide spraying. Think about what's happening with Zika in the southern states. More outdoor pollutants like pollens will also mean more asthma and more asthma absenteeism. One of the other things that concerns us is that school buildings which may already have some structural issues. For example, a crack in the foundation or broken windows or a roof that already leaks, a little bit of flooding problem or water damage that happens seasonally in the spring, they're much more likely to be more severely damaged when there's a severe storm coming through. So the question after the fact is, if there is a big storm and if there is significant damage to a building, there is always pressure by the community to reopen quickly to normalize children's lives. But the other question to ask is, what guidelines are there for assessing the damage of schools, and who does that to clear a damaged building for safe reoccupancy by children? And the answer is no one does that right now. We'll look a little bit at indoor air and dampness. I will make the point now, because we've heard about it a lot, there is no such thing as a mold-free school or any other building for that matter. Molds are everywhere all the time. And with any increase in moisture and heat, they will grow inside. They will grow and infest any building material or furnishing that can hold moisture. Even as simple as a dirty computer housing or casing, books, curtains, wood floors, wallboard, even the lettuce in your refrigerator. That's what's happening to it. So molds actually are digesting the building when they land and start colonizing a surface. The standard advice from every health department and environment agency in the country regarding mold and moisture problems and indoor air problems is always take the first complaint seriously and investigate it fully. Catching problems early is absolutely the way to go. Prevention works. I'll say a little bit about drinking water at the end, but just to remind you, it's not very far from our thoughts. This has become an enormous issue nationally post-Flint, but it's been an issue for a very, very long time. And we're delighted that a lot of schools are beginning to take a hard look at it. I want to touch briefly on some of the federal activities that have taken place over the last 20 years regarding preventing environmental health risk to children. I'll remind people that the U.S. EPA back in 1995 actually kicked off its Indoor Air Quality, that's IAQ Tools for Schools program, which is a voluntary guidance and grants on indoor air. They gave both national cooperative agreements and many regional grants for a very long period of time that were incredibly helpful to moving that issue. In 1997, there was a presidential executive order on protecting children from environmental health risks and safety risks, and there was also a president's task force that was set up. I will remind folks also that that was under President Clinton and President Bush, and I believe in 2007 renewed that executive order, so it's still very active. One of the things that executive order set off was that agencies like CDC, EPA, and the National Institutes of Environmental Health Sciences began funding children's environmental health research, and they set up other programs and grants. One of those programs is one we're particularly fond of, that both CDC and EPA co-designate and co-fund what are called pediatric environmental health specialty units. These are medical centers, typically, with particular expertise in pediatric environmental health that are available in each one of EPA's 10 regions to conduct training and community outreach and train fellows in pediatric environmental health. A little bit more on preventing risk. Some of the selected federal policies that have been put in place. This is by no means a comprehensive list, but these are some of the things that really touch on the issues that are near and dear to the heart of Healthy Schools Network. In 2001, $1.2 billion was appropriated by Congress for public school health and safety repairs. In 2002, the Healthy High Performance Schools Act was embedded in No Child Left Behind. One of the things that did was cause the U.S. Department of Education to publish for the first and only time a national priority study on how decayed school buildings impact children's health and learning. Very significant that they put it out under their own name. In 2007, under the Energy Independence and Security Act, there were also healthy schools provisions. Those were authorized EPA to develop new federal guidelines and award new grants to states to address school environments. This is pretty significant. This actually represents a sea change at what happened at EPA. EPA's guidance documents on things like indoor air and radon and school design and molds and moisture and any number of other things are primarily voluntary guidance documents related to how you deal with one building. This particular guideline took the approach, this particular authorization took a slightly different approach and told EPA, it's wonderful that you've got these great guidelines for individual buildings and small districts. How can the states help their local schools on these environmental issues? And that really has led to a very interesting array of work in 5 different states, which EPA is now embedded in its updated guidelines for states. In 2009, the stimulus bill, AARA, allowed states to allocate up to $5 billion. Across the country, it was $5 billion, and the state could use some of its allocation for school facilities. In 2012, pursuant to 2007 authorization, EPA actually got new guidelines and grants out the door to 5 different states, and now there are new updated guidelines for the states. And in 2015, I suspect some of your folks are more familiar with it than we are, but the Every Student Succeeds Act, ESSA, Title IV particularly, allows states the option of addressing chronic diseases like asthma through environmental management. That has something to do with cleaning and maintenance of facilities. Obviously, the money could not be spent specifically to fix buildings, but it's helpful to have the states produce guidance and their own coordination around those issues. The federal programs that assist school personnel have been in place for a very, very long time. At the Department of Labor, of course, there's the Occupational Safety and Health Administration. Excuse me, I'm going to get a drink here. And at CDC, there's the National Institutes of Occupational Safety and Health. These are labor and health programs that do quite a few things: regulations, tracking, research, education, clinical and support services for workers. And these are very explicit federal authorizations for worker health and safety. But those programs have no authority for non-employees in what they term hybrid workplaces. A hybrid workplace is a place where the occupants actually outnumber the employees, and that looks a lot like schools and airplanes and hospitals and things like that. There are no federal agencies and only a few states that do any monitoring of school facility conditions, and none that we are aware of that consider the impacts on children. So my office actually did a little bit of research about a year or so ago. We did opportunity telephone interviews courtesy of ASTO, state and territorial health officials, and NACCHO, city and county health officials. We talked to senior staff in 13 different jurisdictions represented on the map. And what we were trying to figure out is when they had incoming calls from parents or school personnel or other people, how they handled those and what they were doing with them. Were they collecting the information? Did it lead to new interventions or new kinds of tracking programs? And it turns out nobody was tracking it. And there was no coordination we could find by state or local health agencies of health complaints regarding children at risk. I thought that was really very interesting. So I want to take a deep dive here for a minute and describe what a state can do. We've seen a number of different states do different things. I'm based in New York. I'm very familiar with what the New York State Board of Regents has done. This is back in 1994, they developed a advisory committee and a report to the Board of Regents on environmental quality of schools. It's, to our knowledge, the first example of any state board of education convening an advisory group to propose guiding principles and actions to address facility quality issues. And they took on everything. They took on lead and radon and asbestos in drinking water and even electromagnetic fields at that time. Their guiding principles at that time began with every child and school employee has a right to an environmentally safe and healthy learning environment, which is clean and in good repair. Every child, parent, and school employee has a right to know about environmental health issues. School officials and appropriate agencies should be held accountable. We agree. Schools should serve as role models for environmentally responsible behavior. We agree. And, of course, federal, state, and local entities should work together to ensure resources are used effectively and efficiently. It's a very broad set. It's very optimistic. So let me give you just a snapshot of some of the results. The New York region really, that document really spurred a series of very early reforms. In 1996, the voters approved a bond act that had that included $125 million for clean air in schools. That was used to replace coal-fired boilers in New York City schools. In 1997, the voters the following year rejected a school facility bond act, but they did enact comprehensive laws on school indoor air quality. requiring schools to have a number of documents in place, like indoor air quality management plans and building condition surveys and protection of occupants in schools under renovation. In 2001, the legislature passed and the governor enacted safer pest control measures. In 2003, the elimination of elemental mercury in schools. In 2005, New York was the first state to enact a green cleaning law requiring all public and private schools to use third-party certified cleaning products. That was matched by a state executive order on all the state agencies. In 2007, and I'll keep going, but there's a significant amount of work here. In 2013, New York was one of those states that received an EPA grant to create Clean, Green, and Healthy Schools program. It was very exciting to see that kick off. 2014, state voters approved a $2 billion Smart Schools Bond Act. Some of that could be spent actually on the buildings themselves, particularly to replace portables, which is a great idea, and a couple of other features. And then in 2016, the governor enacted, just a couple of weeks ago this month, the New York State Safe School Drinking Water Act. So there's been quite a bit of work over quite a few years, which is not to say that all the problems are solved, but it will give you an example of what some states have been doing. And New York is not alone in having many of these things in place. There are 30-some-odd states that have laws on indoor air quality. There are 20-some-odd regarding safer pest control. So lots of work has been taking place for a long time. So what do we know about what the states are actually doing? Not a lot, because it's very difficult to actually track what's in place. And so we turn to Healthy People 2020, which is a multi-federal agency benchmarking tool, and take a look at what CDC found in terms of school indoor air quality and some of the other issues. And I'm afraid to say that the information's kind of depressing. For all the hard work on some of these issues that has taken place over many years, there are today fewer schools addressing indoor air quality management plans than there were in 2010. There are fewer schools engaged in chemical materials management than there were in 2010. There are fewer schools engaged in safer pest control practices than there were in 2010, and far fewer schools taking action to inspect lead in drinking water. I suspect if somebody did the poll today, that would be reversed just based on all the media. So Healthy People 2020 sets goals, and they want people to keep moving ahead and have more and more activity and more participation. Instead, the reverse has taken place on these issues in schools. It's very disappointing. So one of the things that we did to begin to try to address this is we looked at all the things that were put in place on school facilities across the country, and we looked at the fact that children were still at risk in bad buildings. And we put together two different conferences, one in November of 2015 and one in June of 2016. They were both facilitated conferences. They engaged 76 senior staff from over 48 NGOs and federal and state agencies. And what we were looking at was environmental health at school. Who's taking care of children and who's measuring the buildings? What I will say is the reports from the November conference is available up online on our website, as well as the presentations. And the same site, a site very close to that, is also available for the June conference agenda and the June conference presentations. So in November, we heard from NIOSH, and we heard the NIOSH director, John Howard, talk about opportunities to integrate children's environmental health into schools and child care in research programs. We thought that was a very positive step. Several offices from EPA participated and talked about the role of the Office of Children's Health Protection in indoor environments. their federal, state, and NGO grants, and the guidance documents that they've produced. The Massachusetts Department of Public Health talked about using the Affordable Care Act to track children with asthma. And Lawrence Berkeley Labs, which has been a long-time contractor of EPA on indoor environments, addressed some of the emerging research on indoor environments and the impacts on children. And that especially addressed CO2, carbon dioxide. The picture on the left is something you don't want to see. If you go visit your child's school and you ask to see a custodial closet, you really don't want it to look like that. That is a custodial closet that would indicate that you can't possibly clean the building, not only because it's bad, because it doesn't have great materials, and the closet itself is dirty. So that's not a great example of a good custodial closet. Here are some of the participants and the leadership for the November conference. Ruth Etzel from EPA on the far left, Jerry Paulson, myself, Suzanne Condon in the dark suit with skirt, Department of Public Health, Laura Anderco from the Mid-Atlantic Center for Environmental Health, which is now at Georgetown, and Bill Fisk from Berkeley. In June, we revisited many of the topics and many of the recommendations from the November summit, but with a smaller crew from November, and then extended ourselves to invite many more people to that who hadn't participated in November. So we were trying to get a broader mix. We were delighted to have a keynote by Patrick Bricey, the director of the National Center for Environmental Health and ATSDR, as well as a keynote panel, again, from US EPA. These are really critical agencies in the work for environmental health. Let's turn quickly now to the new report. As Travis mentioned in the beginning, this is the fourth triennial report we have done. Each year it's gotten a little more complicated, or each edition rather, it's gotten a little more complicated, and I think we sort of broke the mold with this one in terms of the amount of data we were trying to track and publish in one document. There is a book online, which is on our homepage, which is healthyschools.org. But just to give you a flavor, this is what we call the top line data, which is not good news as far as we're concerned. And what the top line data suggests, there are just slightly fewer public schools than there were 3 or 4 years ago. There are more children in those schools. There are more children with special needs, more children with asthma, more children in subsidized meal programs. Overall, there's somewhat less money for schools, both at the federal and in the state level, which means fewer staff. And as we've already seen from the Healthy People 2020 report, there is less activity on environmental health issues that are really important to children's health and safety. So this is not a particularly great news document. I wish it were better. So I won't show you all the state pages, but I'll just give you a glimpse. From California, Texas, and New York, the 3 largest K-12 systems in the country. We did a couple of special things. One is that we culled media articles, media reports, and newspaper stories during every day of calendar 2015 that talked about environmental health hazards in pre-kindergarten 12 schools. We found them in all 50 states, multiple examples in many states. And when we could, when a particular school was identified, we also looked at the enrollment. So you can see in the California list, for example, LAUSD, Los Angeles Unified, is relocating students from 2 Porter Ranch schools due to a gas leak. The children in that school, there were 1,800 at that time. The second one down, summer begins with PCB remediation. That's Malibu High School. Many news clips on Malibu. Children enrolled in the high school are 1,200 at that time. So we tried to keep track of this as a way to illustrate the range of difficulties that state education agencies, state health agencies, state environment agencies are aware of but probably not tracking. what that means for children, and remind people that there aren't any state or federal agencies collecting the data or monitoring exposures. However, no data does not mean no problem. We'll look at two other states. California, by the way, has a little over 10,000 public school buildings, enrolling about 6.3 million children. Texas is close to that. It has 9,300 school buildings, enrolling 5.2 million children. New York State has 4,900, almost 5,000 individual public school buildings, and enrolls about 2.7 million children. And again, you can see that when we could, we tried to find the number of children enrolled in the schools that were affected by whatever the issue was. We also identified honor roll states because there is good news out there. And we use specific criteria. We've not tried this before. We use the criteria, basic criteria, that we hope they had a state-adopted OSHA plan. In other words, there are indirect benefits for children by having some protections for adults in the buildings. We also looked at state funding for school construction. We think it's really important for states to help local schools with their construction and renovation and repair costs. We looked at no drop in mean expenditure per student. And then we considered 3 out of 5 state policies in place. Now, if we'd done 6 out of 6 policies, we would have even cut the honor roll even smaller. We looked at 3 out of 5. One was reporting of food allergy incidents, one on green cleaning, one on high performance and or green building design, voluntary and mandated guidelines in place for school construction, indoor air quality protocols consistent with EPA's guidance documents, and safer pest control. I wish there were more honor roll states. It's possible to get there. We need to look a little bit, drill down a little bit. We have a particular discussion page, 2 pages actually, on PCBs in schools. We're very grateful to New York lawyers for the public interest down in New York City. They've done enormous work on PCBs in New York City schools. PCBs represent an IQ risk, particularly to children. It operates a little like lead. And the information is there. EPA banned PCBs unless they were contained in 1979. They're in old light fixtures, in caulk, in ceilings, and in floor tiles. So just about everywhere. An EPA study in New York City found leaking PCBs in all the schools they examined. And one of the results of that is local parents taking action. That's certainly what's happening in Malibu in California. Here's another issue regarding climate change and children in schools. We see more evacuations and more building damages due to extreme weather events. One thing that attendees might want to think about is schools are very often the largest masonry building in any community, outside of major cities, of course. But they're very often, as a result, designated as emergency shelters. But they may not be designed to be climate resilient or be maintained to be a community shelter. And just a reminder, there aren't any agencies that we're aware of that actually clear a storm-damaged school for safe reoccupancy by children. I think that's a real oversight. Here's an example of what's called fence-line schools. I think some people on the call today understand what the fence-line community is, one that literally has a fence between itself and the refinery, on the other side of the sidewalk. This is an example of a fence-line school, and we're indebted to Ron White and the Center for Effective Government for a wonderful report they did on fence-line schools about a year or so ago. They found that close to 5 million children were attending schools within 1 mile of a hazardous facility, which is listed on EPA's risk management program. It's really an astounding number. We also know, as many folks do on this presentation, that the poorest communities are often much more exposed to environmental hazards. So it became more important, as you can imagine, for EPA to issue a guideline on school siting. That was part of their authorization back in 2007. It's a very comprehensive document. The Office of Children's Health, with an advisory committee of about 20 people, worked incredibly hard on that. I understand there is now a new guideline regarding the siting of child care facilities that CDC has worked on, and that's a good idea too. I'm glad to hear about that. So this is an example of what happens when a new hazard moves in next door. So the little red dots on this map are actually local schools. And this is a blow-up map of the city of Albany, which is right where all these little red dots come together, is the city of Albany, New York, which is the state capital. And this is one of the things that has happened, is there is a new hazard introduced into this area, which is the shipping of Bakken crude oil by rail to the port of Albany on the Hudson River. So the number of schools within 1 mile of the Bakken rail line, the lines carrying the Bakken crude, there are quite a few across the state. I think there were more than 300 or so. Rochester is probably the most heavily impacted city in that regard. There are actually a couple of schools in downtown that would not be able to evacuate because they're surrounded by rail lines. In the city of Albany, about 13,000 people live within 1/2 mile of the rail lines. About 30,000 live within 1 mile. So in summary, from our perspective, that state education agencies can't be alone in this. State education agencies and leaders simply don't have the capacity to address school environmental issues alone, nor should they try it. The facility policies and best practices really require the expertise or the programs of sister agencies in health, environment, and energy. But when you look at all the impacts together, the fact that there are more children in more buildings and fewer staff to go around and less money, we reiterate our findings from the previous report from a few years ago that we consider all children at risk for additional health and learning problems due solely to the unaddressed and unexamined threats in their schools and the lack of public health services for children at risk. We firmly believe we will not be able to reduce these risks to children unless and until public health and environment agencies rise up to take charge of this problem that's been ignored far too long. So let's give you one hard example of unaddressed, unexamined risks, and that's lead in school water. It's the poster child for something that's been ignored far too long. EPA rules do not require schools that are on municipal systems to test at the tap, but schools on their own well water must test and report to EPA. The school meal program is an interesting opportunity to look at the issue because it encourages drinking water instead of soda at school, and the program also requires kitchen inspections. What we've learned, however, is while the kitchen inspection is moving on, they're really looking at sanitary conditions and hand washing stations and so forth, but it does not specifically require testing at the tap. Flint, Michigan media really took off during 2015, and now we're most of the way through 2016. Spring this year, just 6 months ago, at that point in time, there were 24 states that had bills pending on drinking water quality. 10 of those states, each had multiple bills, were trying to tackle school and child care water quality. What's interesting to me is the governance structure that gets involved here. The K-12 system across the country doesn't have, all the state boards of education have similar responsibilities, but they don't have the same authority, or they're not operated the same way. The New Jersey and the Oregon governors have the ability to direct their ed agencies to act in specific ways. District of Columbia and New York City are under council or mayor control. so they can establish what they want to do. In New York, we have an independent board of regents, which is long-standing, so we had to go to the legislature. And the governor signed the Safe School Drinking Water Act in September this year and issued emergency regulations the next day. So I point out in terms of being ignored too long, if you remember, I talked about a New York Regents, Board of Regents report that recommended testing at the tap for lead. That was obviously ignored for a very long time. That came out in 1994. So early in the 2016 session, we and other NGOs saw that there were multiple bills pending, and we needed to figure out for ourselves what would be a 5-point, what would be an action plan? How do we assess what these bills are doing? How do we get a grip on what we think should happen? We put together what we considered an action point for safe school drinking water. It needs to be tested at the tap. You need to plan to provide free water. You need to tell the community and tell the Department of Health what's going on. You need to fix the problem and then evaluate what's going on. It's pretty basic. But water quality is an incredibly complex topic, which we've all been on a learning curve, and I think many of us are still on that learning curve. We found the governor's program bill that was introduced the last day of session after a great deal of many trips, many press conferences, and many conversations, actually addressed all 5 of those points and also, fortunately, includes reimbursement for testing and remediation and a biannual report by the State Department of Health. The governor signed it and issued emergency regulations. So we've been asked whether or not we consider the New York law to be a model law. The answer is no. It was not deliberately designed to be that, but we do consider the 5-point action plan to be a model action plan. And we would really recommend that people pick it up and begin talking about how they might do that in their own fields, in their own world. So here are some selected resources that we use. The current report, Reducing Risk to Children's Health, which we just published this year. It's available free online. Towards Healthy Schools, Progress on America's Environmental Health Crisis. That was published in 2003 and is still available online. US EPA's Healthy Schools, Healthy Children website has fabulous material, wonderful guidance material and best practices for individual school buildings as well as for states now, and of course a citing guideline. CDC's National Center for Environmental Health and ATSDR has a particular section called Children in the Built Environment. They also have a children's strategy, and we love to see CDC and EPA be able to work together more closely on their preventive environmental health strategies. We'd also contributed to a commentary which is appearing in the July issue of the Journal of School Health, which is the significance of the school physical environment to school health. School health has morphed quite a bit over the last 20, 25 years. The current CDC model does not really talk about the physical environment at any great length. And several of us, including Bill Fisk and Jerry Paulson and Lloyd Colby, decided it would be a good idea to get a commentary in print on just to bring everybody up to speed on that. The National Research Council in end of 2006 published something called Green Schools, Attributes for Health and Learning, which is a valuable document. EPA funded the Institute of Medicine in 2011 and came out with Climate, the Indoor Environment, and Health, which is a fabulous document. We quote it twice a day, whether we need to or not. It really is wonderful talking about the extent of exposures in indoor environments and the potential impact of climate on occupant health. And we ourselves have an award-winning clearinghouse, simple fact sheets and guides to help parents and others come to grips with some of the school environmental issues. Before I close, I want to invite people to join us for the 15th Annual National Healthy Schools Day. That will be Tuesday, April 4th of 2017. That is Tuesday of National Public Health Week. And if you go to the website now, you'll see all the materials up there from the current year and the year prior. We have a map of events, We honor our partners. I think last year some 3 dozen, including EPA, CDC, American Public Health Association, National Environmental Health Association, and many, many other organizations. This has never been set up as one day to hold one event in one city and everybody come to one conference. It was really designed when it was set up to encourage people across the country to develop their own activities or own events, whether it was something simple like a letter to the editor or something a little more complicated like a gubernatorial proclamation or a legislative resolution. So we have examples of all those activities up online, plus checklists and everything else, and we really encourage participation this year. I think the 15th annual is a great time to show a lot of support for what children need every day of their work week. And we will be facing a new administration in 2017, making it all the more important, I think, to give them a good blast of what needs to happen to improve school environments and begin turning around those numbers that Healthy People 2020 reported earlier this year. And I think that's it. We're very grateful. Thank you, Travis, so much for the opportunity. This is how you reach us. We have 3 websites, actually. The primary is Healthy Schools. National Healthy Schools Day is an independent web because we do not engage in advocacy that day. There is no lobbying that takes place. That's why we have our federal partners with us. And Cleaning and Healthy Products, Greener Products and Healthy Products for Schools, which is a national collaborative website. Travis, do you want to take over? I think if there's some questions, I'd love to hear them.
Yes, thank you very much, Claire. That was a really interesting presentation, and we would love to, before we go into a time of Q&A, because we do have some questions, I want everybody to know under the, in the chat box, you'll see a form. I'm sending the link to everyone now. It's sort of a feedback form, and this gives us an opportunity to see how the presentation went, what you got out of it. There's the form is features some boxes specifically for those in the education sector. If you're not, please do fill out the form anyway. That would be really helpful for all of us. Many questions have come in about the recording. I'm going to check with, this is done through the George Washington University WebEx. I'll speak to the tech people tomorrow about getting a file for everybody who wants one, and we can send out a link once that has all been taken care of. And anything with slides being available or the PowerPoint being available, I'll let Claire address that question because that question has come in. Will slides be available, and will we be able to, and can the above resources be emailed to participants? Claire, would you like to take that one?
Can resources be emailed? Which kinds of resources? We've put some web links up. What kinds of resources are you thinking? The PowerPoint itself?
I'll have the person who asked that question send that to me privately, and we'll coordinate the answer for her, okay?
Absolutely.
Okay. And when the recording is done, we will also have a link up on our website that we can send to everybody. So we'll all be able to see the presentation. I know, I think Healthy Schools Network will do that as well. So the first question that we have is, what kind of things can schools do to reduce risks at little or no extra cost?
I think one of the easiest things to do is to switch over to non-toxic supply purchasing. You know, there are a large number of states now, these are state agencies and governors that have established really robust green procurement programs. We know from the field that the use of green cleaning products, third-party certified green cleaning products, can be done at no additional cost or sometimes at a significant savings. We also know from some of the state agency reports, their progress reports on green procurement, that things like buying EPEAT-rated green computers will have fewer toxic chemicals, plus they're energy efficient. New York said it saved $100 million on an upfront purchase with EPEAT-rated green office computers. I mean, that's $100 million is nothing to sneeze at in the education world. So there are a lot of great examples like that. We also know that safer pest control using, mechanical natural controls and eliminating chemical treatments of lawns really can save a great deal of money and is largely unnecessary. So there are a number of wonderful things that you can do. That also, green products also extends to desks and furnishings and interior paints. So there are a lot of wonderful materials out there, and that would be an easy first thing to do. The other easy first thing to do is to make sure you take the first complaint seriously. And when you see that there's a roof leak, get it fixed as soon as you can, because when you don't get it fixed, it leads to a cascade of water damage and mold and moisture and much more extensive repair jobs. So that really, taking preventive steps early on tends to save money. We also know from a lot of work that EPA has done, and we can provide, I don't think we've posted that web link here, but healthy indoor environments, learning places for children, really save on attendance. They save on student health. They save on adult retention of workers and productivity. So these are savings that are a little bit harder to calculate when you start thinking about having more people in the building and having happier people in the building and healthier people in the building and getting better test scores. All of it counts. If you're in a state that reimburses based on average daily attendance and you can improve your attendance through better environmental management, you will generate more revenues. So I think it's important to think about things in a comprehensive way and pick one or two things that are easy to start with and begin to celebrate your successes.
Great. Thank you, Claire. We have a couple other questions, but we're getting close to the 5 o'clock hour, so we'll go ahead and ask this one. I think this is a really interesting question. How many states actually offer funds for school construction or renovation?
Unfortunately, not all 50. In our report, I think the number is currently 12 or 13 of them do not currently. And then there's some flexibility here. You might have a governor who decides to cancel school construction dollars for the whole state for a period of time, for a year or two to get a new study in place. You might have a state which has a particular fiscal crunch that wants to suspend it or cut it way back. But currently the number, I believe, is 12. It's listed in the National Data Summary in that. And now I don't have my report sitting in front of me. I'm embarrassed to say. I've got too many papers out here.
Okay.
But we have tracked that. We do have information about that, and I'm glad to get that question.
Great. And if there are any other questions that our participants have, I'm sure that they can get in touch with you at the Healthy Schools Network. Did you want to share with us that web address again? Yes, it's healthyschools.org. And if you have a question related to this particular presentation, if you'd send it to info@healthyschools.org, we'd be glad to pick it up and get in touch with you directly. Great. Thank you very much, Claire, for that presentation. If you want to get in touch with us, any of the participants involved on this call, please do fill out the webinar feedback form. You can ask some questions there as well, and if you have anything that we need to follow up with you on, we'll be happy to do that. Thank you again, Claire, for the great presentation, and we really enjoyed working with you on these 2 webinars. Hope to do it again sometime. I do too. Thanks so much, Travis. All right, thank you. Goodbye, everybody.